In today's Eye on Health, we often think of our health as our physical body. Do we have aches or pains, our heart, blood pressure, breathing? But there's something else that's getting a lot more attention recently, and for good reason. Joining me now is the Director of Behavioral Health for Highmark Blue Cross Blue Shield, Demetrios Marousis. Thanks for joining us.
Good morning.
And I want to jump right into it by asking you exactly what behavioral health is.
So typically behavioral health sort of encompasses both sort of psychiatric conditions as well as substance use disorder conditions.
And so those two can sometimes go hand in hand, is that right?
Oh, absolutely. Absolutely. It's quite common for those to sort of coexist.
At what point should someone seek help? When should they know it's the right time to seek help if they feel like they may have behavioral health issues?
Well, actually, I mean, they should seek help immediately. I mean, this is one of those things that typically by the time a person identifies a need to seek help, they've been struggling with symptoms for quite a while.
So you mentioned symptoms. Is there something key to look out for here?
Well, I mean, it would be symptoms such as stress. It was, things like not sleeping well. It could be not feeling rested even after you've slept. It's, sort of feelings of depression, feelings of agitation. And typically these are more noticed by the people around us as they see shifts in our attitude, our disposition, on how we're handling, our day-to-day life. So
I know often, if we have a medical issue, our first place is to go to the internet and type in something saying, does my symptom match whatever it may be? How do you find right, accurate information to kind of guide you if you're looking for help on this issue?
I mean, there are certainly some, good sources, on the internet, that can be found. But the reality is, talk to your provider. Your primary care is a great place to start in terms of what you're feeling, what you're thinking, how it's changed. Many providers, particularly in our partners in Allegheny Health Network, have integrated behavioral health services within primary care. And so you're able to then get a sort of a warm handoff to mental health services, behavioral health care right within your primary care practice.
Demetrios, does behavioral health issues and problems, do they always contain substance abuse disorders?
No, not always. So I mean, once again, they can coexist independently. But it's not uncommon to see both occurring, where people are managing their stress, let's say, through alcohol consumption, and sort of patterns develop, and where treatment could have been useful, folks are delaying that because they don't know. They're not recognizing the signs and symptoms. They're thinking it's a phase, something will pass.
One of the other big things that's happening right now is a lot of employers are saying, hey, okay, let's come back to work. And this may actually lead to a rise in some other issues too.
It certainly could. And you're really highlighting sort of, and many employers also have employee assistance programs. That's also another great place to get information and secure some support.
And our thanks to Demetrios Marousis. And remember to keep watching for our Eye on Health series right here on PTL. It happens on Wednesdays, and it's brought to you by Highmark Blue Cross Blue Shield, together with Allegheny Health Network for your health.